avoidance. Health analytics is a big opportunity. Our industry, for example, has been sitting on a mountain of data for a long time. We have failed to bring good value from it. That's our own fault, and we have work ahead of us to make that happen. The whole area of behavioral economics is very, very exciting, and there's some great work being done right now trying to figure out how to apply that to healthcare. Because in the rest of our lives, we're being directed and guided and nudged all of the time. And so, given that, why don't we have that happening in healthcare when it comes to the behaviors that need to be seen to change health outcomes over time? It's available to us. It just has not been applied. A lot of work is being done. A holistic view of the person is a big deal. We were one of the early movers back in the mid-'90s around disease management. We had relationships with somebody that did diabetes, somebody that did this, and at the end of the day, I can tell you, I no longer believe in that at all. I think you have to have a holistic view of the individual, and all of that needs to be integrated elegantly on the top of customer relation management type platforms with the right professional, talking to the right patient at the right time, seeking the right care. And that comes from a really total, clean view of the individual, not broken up into little sub-chapters. There's 4 big buckets of well-being, and based on a lot of research that's been done and our own efforts in this space, our opinion is that these don't sound like healthcare things necessarily. Purpose, belonging, security, and then health is one of them. But our argument would be that all of these impact the actual health and wellness and well-being of individuals. And so it's worth working on them all for that reason alone. We also think, frankly, there's businesses in all this for us to have a relationship with people that goes way beyond what we've traditionally done. So, we're working in every single space. But this concept of well-being, I think, has legs. It's being hyped right now. If you just go out there and type that into Google, you'll see that everybody and his brother is talking about wellness, well-being, this sort of thing. I think, we're in an interesting spot to potentially act on that because of the spot we have in the health care system, at least. And so we're pretty excited about what it means to us. This is sort of the categories, the subsets underneath the health. I would take you to the definition because even inside of our own company, people are still scratching their head trying to figure out, well, what does that mean exactly? It says basically well-being is living happily with a balanced sense of purpose, belonging, security, and health. And that balance is the critical piece of this. We've tested a lot of things with our own associates. We consider ourselves a laboratory, frankly. We have 36,000 people that work for us. And I've been CEO for 11 years, we've taken every single new innovative idea that's happened in health insurance or healthcare and tried to apply it to our own folks in an effort to learn whether they work or not. So we've been through all the insurance modeling and all the consumer-directed plans, all of that structure, HSAs, all that, been very aggressive about all that, non-smoking programs. We've stopped hiring smokers in a few places completely, so we push the envelope on the stick side sometimes. We're also trying to motivate people in new ways to do different things. So lately we've been working on this idea of obesity and the fact that a huge percentage of my people are overweight. Several years ago, we did a little data study, which is not publishable because it wasn't blinded in any way, but basically we have the BMI on every single person that works for our company because health risk assessments are required in order to have health coverage. So we have the BMIs, and we also have the health claims experience from these people. And I can tell you, when you look at that, the people at Humana with a BMI over 30 spend almost all of the money. And the group under 25 spends virtually nothing. So, it's probably not statistically valid, but it certainly is directionally interesting. And so if you remember the slides of the United States and the fact that the people over 30 are climbing, you can see the direct correlation right there. So we went internally and said, okay, we have a real problem here. And in fact, our data would tell us year over year, we had about 800 or 900 people a year gaining weight. Same people year over year, multiple years. So we decided to try to attack it, and so we went into the rest of the economy and started bringing some interesting ideas and started running some pilots and some tests. So we had several of them this year. I put a few on the screen here today. You've heard about knowing your numbers is a powerful thing, so we took one program and around the idea of personal health scores, have people participate. About 55% of them actually improved their scoring over the measurable period here. In terms of personal well-being, this is more of a self-declared survey process that sort of studies, and Gallup does a lot of this as well, how people feel about their own well-being and sort of by their definition. And basically we had some efforts and programs and interventions and all of that. We in the category of suffering went from about 10% to 6%, so on the margin some improvement. We did a Biggest Loser Club. That show has been wildly successful on television. We thought, well, let's just try that in the house because I've got a lot of people that need to lose. So we had a big competition there. That group lost about 3,500 pounds in terms of the participants there. And a number of them dropped their BMI below that critical inflection point, interestingly enough. We had a win, place, and show me the money. This is stealing from the lottery concept. And these are all some aspect of behavioral economics work around what motivates people to do certain things. So we had essentially a lottery process built into this as its core driver. And that group lost 8,700 pounds. What happens is basically they qualify to have a name pulled out of a hat, at which point somebody gets a very large check. I don't have any idea whether these are the right things to do over time. We're developing a testing environment where we can continue to probe and find things to get people to do things. I mean, clearly people buy lottery tickets every day. The actuaries in the room would tell you that nobody in their right mind would ever buy one. Statistically, your chances of winning or losing are the same, whether you bought a ticket or not. That's an actuarial's view of the actual view of that. But so again, nobody knows the real answer and where this is going to come. But basically, I think it's a combination of these kind of things. We're going to find things to motivate people. I will guarantee you, everybody in this room has an airline frequent flyer card in your pocket, and every one of you is motivated to use that airline and to go out of your way sometimes to inconvenience yourself to make sure you're hitting your mileage and you're gathering your currency, so to speak. So every day we're confronted with these type of things that do get us to do certain things. And so the question is how do we get those things into healthcare so that sustainably over time we can get to a different place? We're trying to do a number of things and hit people where they are, everything from the technology piece to mobile health screenings to, and I'm going to talk about HumanaCares in a minute, preventive programs. Some of these have been around for a while. Trying to get them all together and get them integrated in some sort of a coherent platform is, I think, the key over time. I'm going to talk about this program because this is an area where, so we were talking about some behavioral change, obesity management, weight loss, and that sort of thing with an interesting intersection between economics, health, and that sort of thing. In terms of this program, like I said, we have millions of senior customers over the age of 65. We're one of the biggest Medicare players in the United States. And so we really study what happens inside of health care for these seniors. And so we're starting to apply some things with these seniors, and we're starting to learn an awful lot of things about what motivates them and how their well-being is actually driven. And there's a whole area out there of work around activities of daily living, which will tell us an awful lot about how an older person is going to intersect with healthcare and what their health situation is going to look like in coming months and years. And some of the strongest questions you can ask these people is, can you bathe yourself and can you feed yourself? Those are really strong indicators of what someone's health status actually is. And if you ask them how do they feel, I mean, that sounds silly. The answer they give you is going to be really directionally strong. So all of that builds us into a situation where we realize we have hundreds of thousands of really chronically ill, fragile old people as part of our customer base. So how do you go after impactable risk? That's the key word here, impactable risk. And so there's a data-driven piece of this. There's some predictive modeling capabilities that go with this. But at the end of the day, what we've learned here is that you basically have to look at this individual holistically, as I mentioned before, and think about what's going on with them, not just from a clinical perspective, but what their life looks like, their capability to understand the health literacy question earlier. Do they understand doctor's orders? Do they know how to take their pills? Do they know what their pills are for? Can they remember to take them? Can they get to the doctor's office for their appointments? Are they compliant with their drugs? Do they have a ride? Can they clean their house? Can they feed themselves? I mean, it's all these support things that are around these individuals which really drives this bouncing in and out of hospitals that we heard so much about during the political debate. The readmission rates in the Medicare program are awful. 1 in 5 people go back in a hospital 30 days after discharge. What we're learning is it's never a clinical, never is the wrong word. Usually it's not a clinical incident that causes this to happen. It is something else that has fallen apart in the support system for this individual. It's either them or somebody around them that's unable to help them, or basically they just have a lousy social structure underneath them. So the question is, how do you get ahead of that? HumanaCares is built to go after that. So it's a full spectrum of finding what it takes to give these people the sense of well-being. Having someone have makeup put on improves their sense of well-being about themselves. These are some strange examples. Having their hair done, mowing their grass, it just goes on and on and on, what it takes for somebody to feel good about themselves. There was a big debate, remember, you probably heard this during the bill, how dare these private companies take tax dollars in Medicare and spend it for gym memberships for seniors. Remember that conversation? Remarkable. Lack of understanding. Because we're not going to take an 83-year-old and get them fit. That's not what we're up to. We want them out of their house, going to a social setting where they interact with others, which keeps them engaged, feeling better, and sharp. And so you could go to a gym, there'd be 50 people in there, all over the age of 65, and there'd be 5 or 6 of them in a wheelchair doing nothing but this. It's not about the workout. It's about the dominoes they play afterwards and the people they see there. And all of our work tells us that that is a significant part of how their health will play out over time, whether their mind is engaged and whether they have interaction with other people. So this is a much bigger answer than just some of the mechanical pieces of our system. It's important because the population is starting to accelerate over the age of 65. We all know about the baby boomers. They're moving ahead. Again, you start measuring the results with these people. You take care of them for a while. You ask them how things are going. They've upgraded their own health status from good to excellent in many cases, over 15% of them. Pain level, no longer a problem. Haven't fallen down. No difficulty sleeping. Sadness and depression is no longer an issue. And you can see there's nice improvements over time. We get pretty optimistic about this. And the actual health spending that goes with these people from the perspective of somebody like us who pays those bills is remarkable what happens. It drops dramatically. This is how you build it. I mean, there's an awful lot of infrastructure and integration that needs to be done relative to this. I won't spend a lot of time on it today, but it takes a village, as our former First Lady said, to make this work properly. This is a unique asset right here because of the things we've described. One of the things we've learned is that there's not a really, also, while we don't always have a holistic view of the individual, we also don't have a holistic view of what's possible for this individual. So we built out a system where, and those of you that are in social work, and I know there's some people in here that do that, this is, I think, the best in the country in terms of having a tool sitting in front of nurses that are working with these people where they actually have at their fingertips all community resources available to solve any problem for them. Many of you all have sat in front of a patient